How many of us look in the mirror and do that and think, oh, I wish it would stay like that? Well, there is a way of achieving that now, and that is with a thread lift. As we age and the skin drops down and falls forward, and we develop the jowl area, marionettes, nasolabial folds, the cheeks can often fall down as well, and the neck becomes loose and a bit scraggy. However, lifting the face in non-surgical terms can be very challenging. And for example, fillers and Botox will help to a degree, but they cannot physically lift and hold the lift there. In my opinion, and with 21 years experience in medical aesthetics under my belt, there's only two ways of doing that. One is with a surgical facelift, and the other way is with a thread lift. Now, thread lifts have been around for many, many years. And over the years, there's lots of different materials that have been used, lots of different ways of doing it, and they've not always had the best reputation. And the reason being is because thread lift is an umbrella term used to describe many different of thread lift type procedures. Unfortunately, a lot of them don't work, and a lot of them don't last. However, if you get the right thread lift, using the right materials, the results can be fantastic. And that's what I want to talk to you about today. So I have discovered a new type of thread system called the Spring Thread Lift. Now, I've been doing this for quite a few months now. The difference with the Spring Thread Lift as opposed to other materials, for example, PDO, is that the spring thread not only gives a much, much better lift, it holds the skin, and the results last between 3 and 5 years, which when you're going for a procedure like a thread lift, you want it to last. Spring threads have been around in Europe for quite some time, and they've made their way over to the UK. And like many of my colleagues now, I will only ever use spring threads. They should, however, be done by a medical practitioner, and they should be done in a CQC registered clinic because of the nature of the procedure. So how does it work? I'm going to show you an animation in a minute and talk you through it to explain how threads are inserted into the skin. But the idea is that threads are placed underneath the skin, and the threads have the capacity to actually catch on underneath the skin. Therefore, when the practitioner lifts up the skin, once the threads are all in place, the skin stays there and holds. I'll show you this animation now, and I'll explain how that happens. For demonstration purposes, the animation is going to show you 3 threads in the face, but depending on what we're treating, usually between 2 and 5 are injected. The principle will also apply the same for the neck area. You can see on the animation that there is an entry point in the temple area marked by the purple dot, and then in the lower face there are exit points, and up in the scalp there are also exit points. A needle is placed through the entry point, which is a very small needle-sized hole. The needle is then twisted, and this is in the fatty layer underneath the skin. The needle is taken down through the face to the exit point in the lower face, and with it, it brings the thread that's attached, as you can see in the picture. The needle and the thread then exit from those lower face areas. The other end of the needle goes back into the same entry point, and in the same manner is taken underneath the skin up into the scalp. Once the threads are all in place, they can then be pulled and tightened. And as they are pulled and tightened, the skin will catch on to the threads and therefore hold the threads in that lifted position. So once the threads are all in place as shown in the animation, they are lifted against the skin and tightened and the ends of the threads cut off. So what you look like immediately after a thread lift, there is some swelling, which is expected. There are little tiny needle points where the threads have gone in and come out again. Now, there may be some bruising because it is a bit of a procedure, and also there may be some puckering of the skin. Now, this, of course, is done with local anaesthetic. You're not going through this in a painful way, and the amount of anaesthetic used will depend on how well you're tolerating the procedure, but the idea is to give you minimum pain. The thread lift can apply to the face, or the neck, or even the eyebrows, or all three in combination. Now, once you've had your thread lift, you'll probably need about a week of downtime. Again, that varies from person to person, but the great thing is all of the entry points, which are about here, can be covered by your hair. And once we've reviewed and made sure that you're happy with the results, then you're done for the next 3 to 5 years. So, in my opinion, the spring threads are a game changer when it comes to lifting the face, holding it there, and keeping it there, and giving you many years of pleasure.